they got to do it for Malaysia, Let's take some answer, but I think it's rubbish. They're probably making money out of it now. Okay, next one. Okay. The way in which public funds are dealt with by this group in power, would you trust them with a 30-40 billion fund to revamp the system and use it for the maximum benefit of a population? Even if the reforms they're suggesting is okay, and there's already a problem with the reforms itself, the kind of reforms. But the reformer, I think, is a bigger problem. Next one. He's out of a job soon, I think. So maybe he can give him a job in the NHFA, CEO, NHFA. So these people, are you prepared? Next one. My good friend put me in for 5 weeks for no reason. See this fella, when Shahrizad's thing came out, within a week he came out and said there's no foul play involved. Do you remember or not? Shahrizad's thing. How they cover up. Every year the Auditor General comes out saying there's so much here, loss here, and no one is stopped. So with this kind of corporate, this kind of government culture, can we afford to get them a sum of money and say handle our healthcare system? Who knows who this is? No, David, don't say. Who knows this one is? This is Anurin Bevan. He's a Labour Party left, and in 1950s they fought, 48, they fought and brought about the socialized healthcare in Britain. But they were socialists, they were left. I mean, they were not these corporate jokers, So you must have those kind of, let's say if you have these kind of people in power and you ask them to do reform, okay lah, got chance lah, But the present batch, you cannot have this kind of people and do reform. They're going to go into their pockets and the pockets of cronies. 60% of our families have a household income of less than 3,000 a month. 40% is below 2,004. We're still, I mean, of course, we're a rich country, but but people are poor. So they're going to go and cut their pay. So it's asking to pay an extra amount for health tax is a bit hard. Reject the market approach. That's one. I think I'll first say is delay. Don't go for reform of anything until we change this fellas. I think our first idea should be to change the government. Okay, maybe I'm partial. Okay, the second one is reject this market approach to healthcare, and third one, we must be open to the whole process. Whoever does the thing must be open from the beginning. Because some things, some changes are irreversible. You let the genie out of the box, you can't bring it back in. Just for example, the private hospitals now. We say the private hospitals are the ones that have weakened the public sector. But right now, even if we take over the government, Pakatan takes over the government, we cannot go and say renationalize all the private hospitals. People have, I mean, there's a whole, people have gone there, they put in money and all that. So what, say at PSM, what we're saying is we should freeze private hospital expansion. Don't let them build any more new private hospitals, no extra wings, just freeze them as they are, let them continue. Can't stop them. But if you don't let them expand, then they cannot keep on pulling out, because once they are saturated with the specialists, given the present facilities, at the same time we must have a better system, we want to have a better terms of pay for government doctors. Have a separate service commission, they call it service commission. Now they're under a common service commission. Have a separate one. Like the military has got one, the judges have got one, teachers have got one. Do one for the healthcare system lah. Pay them better, but not only pay lah. Give them things like sabbaticals. Because medicine is always changing, So every 4 years, a specialist in government service works for 4 years. You get a 3-month fully paid sabbatical. You go and learn a new scope or new procedure, go for a course and come back. That all these perks will keep people in, So I think you must think of something that way. And if you do that, but you cannot go and privatize the existing private hospitals. I think that will create a lot of unhappiness among the whole sector. Those people working there, the people invested in them. So that's what I mean. Once you make a change, you cannot pull it back. Certain things cannot be pulled back. Once you give certain things, So that's why I think we should not allow any change to be made. We must fight to retain, because there's still a lot of good in our present system. We still have a national grade. There's still hospitals. It's very badly wounded, but it's still alive. Don't let these fellas kill it off, because we can still rehabilitate it and use it for the people's benefit. So I think it's still worth fighting for, So I think we should fight, prevent it from getting killed off really, until we can improve. Not saying it's the best system. There are a lot of problems with it, but it can be rehabilitated. and I think it's worth fighting for. Thanks.